WHO's recommendation is that they should be monitored actively at a specified quarantine facility or at home for 42 days from the last exposure, which is the 10th of May, which takes us to the 21st of June. Anyone who becomes symptomatic should be isolated and treated immediately.
W.H.O. has reported 11 total cases. 8 were confirmed from laboratories to be Andes-virus, Hantavirus.
So the WHO just issued a public health warning over Hantavirus, and now more people are reportedly testing positive. And that immediately got attention because, as you guys probably know, whenever the WHO starts publicly flagging something, people start looking at one question first: how serious is this actually getting? And what makes this worse is that despite officials repeatedly warning people not to panic, people are starting to wonder if we're about to witness another COVID-19 situation, complete with the lockdown, the deaths, the anxiety, and the economic hardship that followed. And honestly, it's hard to blame them when new cases keep popping up every day, especially now that we now know it might be until mid-June before we know just how bad this thing is. So now everyone's asking whether this is just isolated cases being monitored, or whether health agencies are seeing something bigger developing behind the scenes. And that's where things start getting uncomfortable.
I'm blacking up from Boston. I just want to say that I heard that there may be 2 people who were exposed to the hantavirus living in Georgia being monitored. Baby, it takes about a month for those symptoms to show up. What are we doing? Because what we're not going to do is act like they didn't just tell us that the ship was over in quarantine over in Cape Verde or Cabo Verde, however you want to say it.
So, the conversation surrounding this hantavirus outbreak completely shifted after a health update out of Maryland started circulating. The Maryland Department of Health announced they were monitoring 2 Maryland residents following a potential hantavirus exposure connected to a passenger from the MV Hondius cruise ship. And the second people saw monitoring residents and hantavirus in the same sentence, social media immediately started moving. To give you some context, health officials also made something very clear. They said the 2 Maryland residents were not passengers on the cruise ship itself. According to the report, the potential exposure happened during air travel abroad, not on the ship. And they also stressed that these measures were being taken out of caution and that the risk to the public in Maryland remained very low. But that explanation did not stop the internet from doing what the internet always does. Because once headlines started getting reposted, people immediately jumped to worst-case scenarios. And you could almost see the mood change in real time. Because when this was just a story about some cruise ship sitting out in the middle of the ocean, people were looking at it like something happening far away from them. But once that ship docked and conversation started shifting toward people showing symptoms on land, suddenly it stopped feeling far away. People started wondering how close this was and if they should be worried about getting infected next. Now let's get into how this whole thing reportedly started, because a lot of the panic right now seems to be coming from one thing: people hearing the word hantavirus and immediately thinking the worst without really knowing how this situation even began. According to the World Health Organization, officials believe this outbreak may have stemmed from a Dutch couple aboard the MV Hondius who later died after becoming infected. During a recent briefing, Tedros Adhanom Ghebreyesus explained that before boarding the ship, the couple had reportedly gone on a bird-watching trip across Argentina, Chile, and Uruguay. And this is where people online started getting that wait a minute reaction. Because according to the briefing, some of the places they visited reportedly had the species of rat known to carry hantavirus present in those areas. So by the time the couple boarded the ship on April 1st, officials said they were already infected. Now imagine being on that cruise and finding this out afterward, because there were reportedly around 150 passengers on board. And these weren't people from one city or one country. Passengers were coming from the US, the UK, France, Germany, Greece, India, Portugal, Argentina, Belgium, Ukraine, Guatemala, the Philippines, Montenegro, and other places. And once people started hearing that passengers were leaving the ship and heading back home across different countries, that's when the conversation online started changing again. Because now, locals in different places started asking the same question: hold on, what exactly does this mean for us? And who else may have crossed paths with them? Now let's move into what the WHO has actually been saying, because this is where things got a little messy online. According to official reports, hantavirus is typically transmitted through contact with rodents, but officials said the strain involved in this situation has been identified as one that can spread from person to person. And as you guys know, people hear things like person-to-person transmission and immediately start connecting dots to every major health scare they've seen before. And before long, clips and headlines started moving faster than the full explanations. Now, during a recent briefing, WHO Director General Tedros Adhanom Ghebreyesus said that based on the evidence currently available, the chances of this becoming a full-scale pandemic remain low. He also stated that the WHO's assessment continues to be that the global health risk is low. Listen to this.
WHO's assessment continues to be that the risk to health globally continues to be low. There have been no deaths since 2nd of May, when WHO was first informed of the cluster of cases. All suspected and confirmed cases have been isolated and managed under strict medical supervision, minimizing any risk of further transmission. At the moment, there is no sign that we are seeing the start of a larger outbreak.
However, he also explained that due to the long incubation period, there could actually be additional cases that simply haven't been identified yet. And that's where people online started spiraling a little.
But of course, the situation could change. And given the long incubation period of the virus, it's possible we might see more cases in the coming weeks.
Because people who had contact with suspected infected individuals reportedly have to quarantine for at least 42 days. That's more than a month. So suddenly people started doing the math. Because realistically, if people are still inside that monitoring window, then we may not fully understand the size of this situation until sometime around mid-June. And even though officials kept repeating that people should not panic, the internet had already locked onto the fact that this thing could be bigger than we think it is. Now, once this really started spreading online, the reaction turned into exactly what you'd expect from the internet. Because within minutes, people went from sharing health updates to creating entire theories, jokes, and worst-case scenarios. And the lockdown comments showed up almost immediately. Because the second people heard words like person-to-person transmission and quarantine periods, social media started filling up with jokes about another lockdown situation like the one people remember from COVID. And even though a lot of it started as humor, you could tell there was some real nervousness sitting underneath it. Reddit threads started exploding with posts like these, covering everything from people posting actual updates and timelines to others pushing theories that had everyone looking sideways at their screens. Some people were trying to connect dots. Other people were completely jumping ahead of the information available. And the same thing started happening across social media platforms too. TikTok got flooded with reaction clips, screenshots, and people trying to guess where this story was heading next. And tweets like these ones went viral on X. Some posts were serious. Some people were trying to calm others down. And then some people were fully treating the whole thing like internet chaos hour. Because somehow the conversation even turned into people making random jokes about possible side effects, with some posts throwing out wild comments and rumors that had absolutely nothing to do with what officials were discussing. Check this one reaction video out.
Bomb the ship! Bomb that ship! Bomb that ship! That's it. You went on a cruise. This is the way we should handle cruises now.
Meanwhile, officials kept repeating the same message through all of this. They advised people to stay calm and not treat the situation like the world was heading into another pandemic. But by that point, the online reaction had already taken on a life of its own. Now the focus is starting to shift again, and people are looking right back at the place this whole thing traces back to, the ship itself. Because once the health concerns settled down a little, a different question started taking over conversations online. Who, if anyone, could actually be held responsible here? And that question started getting louder because health officials have reportedly been investigating how the virus ended up becoming an issue on board in the first place, because people online keep saying the same thing. Situations like this don't just appear out of nowhere. Now, to be clear, nothing has been confirmed suggesting wrongdoing by the crew, but that hasn't stopped speculation from growing online, because some people started wondering whether there could have been negligence somewhere during the process involving the MV Hantavirus. And then another detail started making people stop scrolling. People began looking at the terms listed by Oceanwide Expeditions, the company connected to the ship. And if you look at the company's general terms and conditions here, they include broad language stating it cannot be held liable for issues ranging from illness and death to lost luggage and robbery. And right now, there have been no reports of passengers filing lawsuits or publicly saying they plan to sue. But that hasn't stopped people from asking questions. Because once words like investigation, liability, and negligence start appearing in the same conversation, people immediately start wondering whether this story is actually finished, or whether the health scare was only the beginning of something much bigger.